Yes, please start your presentation.
Bismillahirrahmanirrahim. Quote of the day: education, housing, and hospital are the most important things for society. Today's the topic of presentation is hospital management under kind supervision of Dr. Saira Afzal. Learning outline of my presentation is introduction, classification of hospitals, function of hospital, management of hospitals, central sterile service department in the hospital, hospital accreditation, and recent advances. In the end of this presentation, participants will be able to describe classification of hospital, management, hospital accreditation, and recent advances. First of all, introduction. Definition of the hospital. Hospital is an integral part of social and medical organization, and its basic function is to provide complete healthcare, both curative aspects and preventive aspects, and outpatient services reach to the family and its home environment. Hospital is an Italian word derived from hospitality, meaning to be guest. It is represented by staff and servant. Staff is the patient and servant is caring of. In US, first hospital was in the Pennsylvania Hospital, founded in Philadelphia in 1751. Mayo Hospital is the oldest hospital in Lahore. What are the factors which are responsible for hospital development? Advance in medical sciences, development of professional nursing, advance in medical education, contribution by industrialists, support by health insurance, and the role of government. Now we classify the hospital in 4 categories according to the type of services, number of beds, ownership, and the duration of stay. According to the type of services, there are 2 types of hospital: general hospital and special hospital. All type of services provided in same hospitals like teaching hospitals, Mayo Hospital, and Jinnah Hospital. And special hospitals, the hospitals deal with specific category like children hospital, in which only the PEDS department is deal, PIC, Punjab Institute of Cardiology, in which only cardiac patients are deal, and Anmol hospitals, in which only cancer patients are deal. Classification of the hospital according to the number of bed. We categorize the regional teaching hospital. In these hospitals, more than 600 beds, and these are hospitals affiliated with different medical colleges like Mayo hospitals, and district hospitals in which 100 to 600 beds are present, and it almost provide 15 specialities like civil hospital, Faisalabad, Sheikhupura, Kasur, and rural hospital in which 20 to 100 beds are found, and it provide medical, surgical, and ops care like Manama Rural Health Center. According to the ownership, we classify the hospital in public hospitals and private hospitals. Public hospitals are owned by the government or autonomous bodies, and private hospitals owned by a private institute, businessman, or entrepreneur. We also classify the hospitals according to the duration: long duration hospitals and short duration hospital. Mostly the stay more than 30 days are long duration hospital, and in this category mostly orthopedic hospitals are involved, and in short duration hospital the stay less than 30 days, and eye hospitals are in this category, short duration. There are different functions which are performed by the hospitals like curative, preventive, and promotive care, domiciliary care, research and training, accident and emergency services, disaster management, physiotherapy, which is provided to the patient, diagnostic services, geriatric services, and medical record keeping. Hospital administration. This term covers large number of activities which may be categorized in 3. Preparation of hospital legislation, planning of hospital as whole, and establishment of architectural control and standard. Application of hospital legislation and social assistance provided by authorities responsible for hospital services. Daily running of hospital by administrative staff concerned with personal finance and technical services. What is the role of administration? Planning for the future while managing present, ability to produce and accept new and creative ideas, ability to coordinate, bringing harmony and collaboration, ability to analyze, synthesize, and integrate diverse information, sense of equity, fairness, and social justice for the patient, knowledge, skills, and experience. Now comes the management, how we manage the hospitals. What is the basic function of management? Enable our patient, doctor, nurses, team to do their work as easily, efficiently, and economically and develop caring environment in the hospital. Basically, there are four principles of management: unity to command, span of control, homogeneous assignment, and delegation of authorities. What is the function of management? By planning, staffing, organizing, directing, and controlling, we manage the hospitals. There are different elements of management: personal management, financial management, material management, and time management. Now we discuss one by one all these aspects of management. First is the personal management. The function of caring staff in the organization is known as personal management. There are two types of management: human resource planning, recruitment, and selection. What is human resource planning? This is information decision-making process designed to ensure that enough competent people with appropriate skills are available to perform jobs where and when needed. Recruitment and selection. The aim of recruitment is to ensure that the organization demand for manpower that is met by attracting potential employees in a cost-effective and timely manner. Basically, recruitment means the hiring the staff for the hospital. There are different steps in recruitment. First is job analysis. How we done job analysis? We categorize in two types: job specification and job description. In job specification, it is knowledge, skills, and personal characteristic which is required for the job holder to carry out job in acceptable standard. And in job description, when we hire the employees, then we inform about the whole task which is performed during duties, and how we attract the applicants by advertisement, evaluating applicants, selection, and then the placement in the organization or hospital. Now comes the financial management. Basically, finance department in the hospital uh, making the budget, formal financial statement of policies, plans, and goals that are designed to ensure that actions are taken within boundaries. There are two types of budget: developmental budget and non-developmental budget. Basically, developmental budget used for new processes like expansion of hospitals or purchasing the machinery of hospitals or instruments, and non-developmental budget is used for salaries and daily expenditure of hospital. How we monitor the budget? We monitor the budget by monthly statement, excess statement, by the accounts department, and auditing. Auditing is basically the analysis of proposed or past expenditure with respect not only to their legality but also to their desirability. There are two types of audit: pre-audit and post-audit. In pre-audit, the audit is take place prior to payment, and post-audit, audit done after payment has been done after purchasing something. Material management. The supply of right thing at the right place at right time and at right cost. This is the material management in hospital. Now comes the time management. Time management is fundamental for adequate job performance. Hospital management should be able to control and usefully consume the time of his subordinates for the welfare of patients. What is Central Sterile Service Department? This is the separate department in the hospital which is known as Central Sterile Service Department. It is a separate department within the hospital which receive, store, process, and distribute and control professional supplies and equipment from all departments of the hospital for the care and safety of patients. The main function of Central Service Sterile Department is to provide sterilized material, contributing to a reduction in the incidence of hospital-acquired infection, to avoid duplication of costly equipment, to maintain record of effectiveness of cleaning, disinfection, and sterilization process, to maintain supply of equipment all over the hospital, to maintain safe environment for the patient. There are different services in hospital which are also provided like housekeeping, kitchen, medical store, laundry, library, and security. Now comes the hospital accreditation. A self-assessment and external peer assessment process used by healthcare organizations to accurately assess their level of performance in relation to established standard and to implement ways to continuously improve. Reduction of medical error is a key role of the accreditation process. Hospital accreditation is therefore one component in the maintenance of patient safety. Now comes the recent update which is related to hospital accreditation. All hospitals in the Pakistan are certified by Pakistan National Accreditation Council, which work under the Ministry of Science and Technology, a government of Pakistan. But introduction of Pakistan National Accreditation Council, established in 1998 after signing WTO agreement in 1995 under the administrative control of Ministry of Science and Technology, Government of Pakistan as the national apex body to accredit confirmatory assessment bodies such as laboratories, inspection bodies, and certification bodies. Pakistan National Accreditation Council is the first accreditation body in the world that has launched Hilal accreditation scheme in 2012. PNAC is the founder board member of International Hilal Accreditation Forum, member of Standard and Metrology Institute for the Islamic countries, has achieved mutual recognition agreement signatory status for testing and calibration laboratories from International Laboratory Accreditation Corporation and multilateral recognition arrangement. Basically, PNAC has also secured regional MRA signatory status with Asia Pacific Accreditation Corporation. By virtue of these all recognition certificates, reports issued by accredited confirmatory bodies are accepted around the world. These are some scheme which is launched by Pakistan National Accreditation Council. These are some certified number which is issued to different organization of healthcare like ISO 13485-2016. This number is used for quality management system requirement for regulatory purpose. In June 2021, hospital accreditation is done by the two numbers 5256-2003 Pakistan Standard for Primary Healthcare Facilities and 5257-2013, which is number which is used for Pakistan Standard for Hospitals. And green building certification is used for the journal construction of a building and safety of the building. Joint Commission International Accreditation. Joint Commission International is a model of excellence for healthcare all around the world. It determines the most effective pattern of working to rule out quality of treatment and steps taken in regard of patient safety. Initially, Joint Commission on Accreditation of Hospital was formed in 1951. It only accredited the healthcare setup and medical center in the United States of America. But after 1991, with increased need for improving the quality standard of healthcare across the globe, JCI was founded that accredited the hospital all around the world. The 4 hospitals that are JCI accredited in Pakistan are Aga Khan University, Shifa International Hospital, Islamabad, Shaukat Khana Memorial Cancer Hospital, Lahore, and Peshawar. These 4 are JCI accredited hospital because they work in the standard of international standards. This is one of the article which is related to the electronic medical record implementation in hospital. Electronic medical record system are key factor for improving healthcare quality, safety, decreasing cost, and optimizing process. And in this study, they combine institutional and individual factor which inhibit electronic medical records implementation in the hospital. These are the references of my presentation. Now comes the MCQ session. Planning new hospital starts with setting goals for the hospital without which the organization cannot have definite direction or focus. Which of the following area is not considered by an organization while studying existing hospital facilities in an area? Bed ratio, hospital occupancy, physical condition of facilities, perception of patients.
D.
D.
D is the right answer, perception of patient, because all other factors are studied while constructing the hospital. Centralization principle of management science has brought the existence of CSSD in hospital. The significance of central sterile service department is to bring advancement in medical sciences, to help the doctors to develop leadership qualities, to bring efficiency and economy in the centralization of sterilization of surgical equipment in one location for us for use all over the hospital, to help non-medical staff to learn administrative skills.
C.
C.
C is the right answer. In hospital settings, employees are attracted by giving advertisement. In this statement, which aspect of job is covered? Recruitment and selection, job description, job specification, job variation.
B.
B.
Correct answer is A, recruitment, because in the recruitment we attract the employees in a timely, and we hire the basically employees in recruitment. And in job description, when we hire the employees, then we describe about how they perform their duties. In tertiary care hospitals, some employees are appointed and give information about scope, duties, and responsibility of particular job. In this scenario, which aspect of job is covered? Job description, job variation, job specification, job variation.
A.
A is the right answer, job description. In the XYZ city, the government has approved the construction of hospital in which the number of beds is 100 to 500. In which category this hospital is fall? Tertiary care hospital, teaching hospital, district hospital, basic health unit.
A.
C.
District hospital. In tertiary care and teaching hospitals, the number of bed is more than 600. And in my statements, the number of bed is 100 to 500, which falls in the district hospital. According to June 2021 Ministry of Science and Technology of Pakistan give the certification number which is 5257/2013 for the standard of hospitals in Pakistan. This process is known as hospital accreditation, hospital certification, green building certificate, global gap.
A.
Hospital
A.
accreditation. A. Hospital accreditation. Hospitals that meet the international standard in Pakistan are registered from which international organization? Joint Commission International, Trent Accreditation Scheme, Centers for Medicare, Council for Health Services, South Africa.
A.
A.
JCI, Joint Commission International, which works in the USA. Administration of Tertiary Care Hospital decided to build new block for the expansion of hospital. Which type of budget used for this purpose by the Finance Department of Hospital? Developmental budget, non-developmental budget, budget of organization, donation from various organizations.
A.
A.
A. Developmental budget.
A.
Gynecologists perform C-section in the OT and the instrument which are delivered in OT is absolutely correct and on right time. In which category of management it is fall? Personal management, financial management, time management, material management.
C.
Material
A.
management.
Material management is right answer. In XYZ hospital, there is biometric system for the attendance of employees and explanation calls for the employees who are not reaching on proper time. This type of management is known as
Personal management.
time management, finance management, material management.
A.
The time management is the right answer. This is the key of my MCQs and thank you.
Okay, thank you very much, Dr. Naila. It is a very good presentation. As far as your presentation is concerned, there are very important points that you have covered overall, and well done. However, please, if you put the recording off, we can have some internal discussion about the presentation and important questions. Dr. Naila, would you please put the recording off?